Good afternoon, Chairman, and thank you for the kind invitation to attend this Congress. I am very pleased to be here, and as an EPCOC, we represent over 32 countries, and we are a federation, and our aim, as your aim, is the same, to improve women's health during their life course approach. So I will now move on to my talk. I'm going to talk about the global events, sexual health and reproductive rights. I do not have any disclosure. So let's see. Yeah. So I just want to quote the Greek philosopher. The beginning is the most important of any work. And I really feel privileged and honored to give this talk standing in Cairo, where the ICPD declaration happened back in 1994. And that was 29 years ago. And if you look at it, 29 years ago, Egyptian Fertility and Sterility Society was also established. So congratulations and thank you. And thank you to Cairo for hosting that ICPD in 1994. That was the beginning of my career in the UK. So the great thing in that ICPD was 179 world leaders reached a consensus, and the consensus was to enshrine reproductive right as a human right. And they all agreed that they should reduce the infant mortality under 5 mortality rates below 45, and the 75% reduction of maternal mortality. And however, 25 years on, there was the Nairobi summit, and EPCOC was signatory to the Nairobi summit. And the progress was there, but the achievement was less than what one expected, particularly in the lower and middle income countries. And these figures, as you can see, are quite staggering. 830 women die giving birth. There are 33,000 girls will be forced to child marriage, and so on. And then the important issue is globally 232 million women who want to prevent pregnancy do not have access to contraception. At the same time, in 2015, the International Committee also thought about the planet. As you see, my previous speaker, Dr. Mahmood, has alluded, the people, planet, and prosperity are the center of the Sustainable Development Goal for the 2030 agenda, which we popularly known as SDG. So ICPD 25 and SDG, they were incorporated to work on for the next decade. And the 3 fundamental issues were identified. One was the poverty, second is the gender inequality, and third is the low educational status. And these are some of the figures from UNFPA. So if you look at sort of the economic advantage and the investment required. So between 2022 to 2030, which is the SDG goal, additional 79 billion on ending unmet need for family planning and ending preventable maternal deaths would avert 400 million of unplanned pregnancy and save 1 million women's lives and generate 600 billion in economic benefits. This is a staggering figure. The second paragraph is also the same, but you can decide to do nothing. If we don't do anything, we effectively save 232 billion at a cost of 5.7 trillion for tomorrow. It is a fitting tribute to Professor Fatala, who also said the same thing. It's not the fault of women, it is the society, and now it is the time has come, it's the global community to think about it. So moving on to global events and sexual and reproductive health, here this is a slide which is a prediction how the population is going to evolve in the next 10-20 years. And as you will see, in the low middle income country, the number of young people 15 to 49 will rise, whereas in the high income countries, you will have preponderance of elderly population, and this will have some impact. The average family size of 2 to 3 children in low middle income, it will decrease with the contraception availability, but because of the population growth, there will be huge demand for sexual and reproductive health service. So any policy planner, any country level, they have to make this decision now. Secondly, the prevalence of other risk factors like diabetes, hypertension, obesity, they are also going to increase. That is also going to have impact on the younger populations where you need more provisions for delivering sexual and reproductive health services, particularly during pregnancy. And late marriage and delay with childbearing is also going to rise, and that will also have effect on infertility. So these are the things to ponder for global, for planning in the future. This is an interesting piece of our socio-cultural determinants. There has been dramatic improvement of women's education. If you look at that upper graph, which is this one, you will see the number of children spending in school, the number of years the children spending at school has increased over the years. However, there has been still a gap between the female and male education. It is closing, more closing in the Western world than in the other part of the world, and there has been dramatic improvement in women's educations. However, the participation in the formal labor force is vastly unprecedented in global market, and this work is an interesting piece of work done by Claudia Goldwyn, who won the Nobel Prize in Economics. So what she did is she looked at 200 to 250 archives in the United States, in Harvard. She's from Harvard University. She's a professor in economics history and also labor economics. And she looked at 250 archives, and what you can see, the participation in labor force did not increase steeply. Initially in 1800, there was a sort of agricultural society. Women were working in the field. Then the industrialization happened. And as you can see, the participation in the labor force outside house actually went down. It is an U-shaped curve. And then gradually started going up when the service sector improved. In other words, when the office-based work improved. And the one thing I brought this slide here is the main issue is in 1972, it was the pill. It was a revolutionary. It gave choice to women. It gave choice to exercise their reproductive rights. So that was a huge impact in the women's labor force. And if you go on looking at it, globally, women constitute 40% of workforce globally, but the gender gap in the earnings still exists. In the same profession, there is a gap between women and men. And that is due to, at a point where the women are making decision whether they want to pursue an educational career or they are more interested into families. And they are influenced by their parents. They see their parents, they had children, they spent time with the children, and then they went to the career, and that's the deciding factor was having the first child. That was the deciding factor in Claudia's research, which said that is one of the reasons for gender gap. And her conclusion was men forego time with their family because they are working out. And women often forego this time in their career. And this was an interesting piece of research, and she was awarded Nobel Prize in Economics in 2023. Changing gender norms. Gender norms are defined by culture and expressed through parts that women and men play in the society. Men and women have unequal status nearly in all societies, resulting in women having fewer opportunities outside home, less autonomy regarding particularly sexual behavior, marriage, reproduction, and decision making. There are double standards in sexual behavior, and this has got an impact on sexual and reproductive health. This has an impact on restriction in contraception. Unmarried women or unmarried men having sex is not often frowned upon, but it is not the same for women, and also they have difficulty in accessing contraception, and that can also give rise to social stigma. So perhaps the reverse role would be we bake a cake and wait for our other better halves to come, and this is what I do, and I'm sure my wife would have not agreed with this picture anyway. So moving on, you probably have seen this picture, the global events on sexual and reproductive health. So 65.6 million people were estimated to be forcibly displaced at the end of 2016, and number of refugees returning has fallen sharply. Over the past 20 years, there had been 340 natural disasters occurring per year, affecting nearly 200 people annually. In Colombia, during the period of internal conflict, an estimated 21 girls aged between 10 to 14 years were raped daily, and about 7,500 annually. So these are the horrifying figures. So what happens is, even with the best humanitarian will, the agencies will be straining to address these concerns. And the prospect of improvement are not favorable in the number of displaced people continue to rise. This picture probably you have seen. This is where the Ukraine hospital was bombed, and the pregnant patient was removed, and unfortunately, I think she died due to the effect of injury. So then came the pandemic. Now, this is an interesting piece of work which was published in BMJ, looking at all of these parameters like contraception, safe abortion, gender-based violence and intimate partner violence, sexual and reproductive health service, utilization by women and girls in the reproductive age group. Now, they have plotted this data almost like a Fisher plot, as you plot in systematic trial. So what they have done is the type of service, they have put it there, and they looked at the review during that time to see if there has been decrease in access or utilization or increase in access or utilization. And I will see most of the activities starting from short-acting reversible contraception, long-acting reversible contraception, to other services, treatment and prevention of STIs. They all had decreased utilization and decreased access. So that was during the time of pandemic. And there was an interesting piece of research from London School of Economics, which the professor concluded, he says, Claire Wenham concluded, the biggest threat to women and girls' lives are not the virus, but actually the closure of the essential services, and therefore they are not able to access those services. The countries which were able to maintain remote services, like in US, UK, New Zealand, and Australia, some of the STI or SRH services went on well to help women, but some of the countries which were not able to do so had a devastating impact. Particularly on gender-based violence, the director of the UNFPA, Natalie Kenham, she said that it was a pandemic within a pandemic about the gender-based violence. Laws, policies affecting health care throughout the world has an effect on sexual and reproductive health. Coercion in reproductive decision-making is a violation of human rights. The China's one-child policy in 1918 had intended social consequences. The number of male is more than female, and there are more people in the elderly age group, and they are themselves having trouble in looking after that. Mexico City policy had a ripple effect throughout the world. Its intention was different, but the effect was completely different in low middle income countries where many people had abortions and unintended pregnancies and its consequences. However, there were major increases in uptake of contraceptives amongst poor, less educated at Malawi and Rwanda, and that was mainly due to strong political leadership. Portugal, Iceland, and Argentina in 2010 legalized the same-sex marriage, and in 2011, Don't Ask, Don't Tell policy was officially ended by Barack Obama, and this is where he was signing, and you can see President Biden and Nancy Pelosi there. Don't Ask, Don't Tell policy was a policy in US Army where you don't tell if you are a gay or lesbian, and you don't ask, and the employer was also not able to ask, but this was felt very discriminatory because they could not identify themselves in their sexual orientation, and this was and it also hampered their career progression, and this was nullified in 2011. Some of the other events in global events are in Uruguay. It decriminalized abortion. China relaxed its one-child policy. And the horrifying thing happened in the Chibuk girl kidnappings in 2014, and it shows how accessing education can often involve huge risks. 2015 was the year when the SDG goals were launched, and the whole idea was to promote prosperity while protecting the planet. Canada moved to equalize the age of consent, which helped young men. And the 2017 was the first ever worldwide women's march, which took place throughout the world, but the biggest march in the US history. Ireland decriminalized abortion. In Austria, Taiwan, Ecuador, Botswana, and Bhutan made LGBT strides, and Taiwan was the only one country in Southeast Asia which legalized gay marriage. Mexico City Supreme Court also grant constitutional right to women for safe abortion. So moving on from global events, I will slightly touch on gender gap, and more women have been moving into paid work over the last decades and increasingly into leadership position and industry, but they have continued headwinds. Now, the global gender gap framework is based on the 4 pillars. One is economic participation and opportunity, educational attainment, health and survival, and political empowerment. If a country has got an index of 1, that means there is no gap between men and women. However, as you can see, at the moment it is 68%, which means it will take at least 132 years to reach the full parity globally. And this is the whole figure. This is overall, it is 68.1%. So the overall, if you look at the country, you probably be not able to read it, but the top country is Iceland, which is 0.98, means they are almost very close. UK is somewhere here at the level of 2022. And in the last 2 years, the 2 countries which made some significance important was Kenya and Saudi Arabia. And you can read they have increased closed the gap by increasing the score. However, as you can see, the economic and social consequences of the pandemic and the geopolitical instability also had a huge effect in stalling or decreasing this closing the gender gap. So what can we do? So we are a professional organization. We are not political organization like you are. We can do advocacy to help women to stand up for their reproductive rights, influence governmental and non-governmental organizations through policy changes. We often have policies in the European Union, and we provide opinion. We organize masterclass. This is a masterclass at Tbilisi in Georgia in 2017, which was organized by UNFPA. And this is Professor Bitzer from Switzerland, who was leading this course. And the delegates most of them were country level leaders. And we did a master class. We did training the trainers. We have a lot of publications. We have recently developed a curriculum in sexual and reproductive health. And we're also going to introduce an exam in sexual and reproductive health next year to help junior doctors, and also somebody who wants to specialize that will be a fellowship. As in a body, as an organization, we have also produced a lot of position statement. My previous speaker has already alluded to it. And we have invested a large amount of time in the new initiative. As a member of this group, I chaired the Health Inequalities Committee and looking at the disparities in the care provision and disparities in sexual and reproductive health care provision across Europe. And we are yet to publish our first set of data. This is the recent UNFPA workshop in Georgia. And we have also published standards of care and armed conflict, and you saw the statement recently we have published in response to the war in Israel and Gaza. Now, to conclude, SDG 3 goals, their universal access of healthcare has not been universally successful. One of the reasons is it may not be that we have been targeting the disadvantaged group, so that is important. Modern contraception is arguably the most revolutionary intervention, and it dealing sex and reproduction. Antiretroviral therapy has saved lives, and medical abortion is another important issue in reducing risks. With regards to SDG 5 goals to eliminate violence and female genital mutilation, recently, I don't know whether you have heard about it, is the Nirvaya gang rape case, which was a turning point in female activism in sexual crime. This was a case where a paramedic who was raped several times in Delhi, and there is also a movie based on this to increase the awareness. It is called Delhi Crime. It is there in Netflix. But what has done is it's changed the legislation. It fast-tracked any cases for legal reforms. And again, for sexual harassment, the Me Too movements, we are all aware of it. So these are important issues in the turning points in the last 10 to 15 years. And as an organization, we are a sectional board of European Union of Medical Specialties. We work with our trainees, they are known NTOG. We also work with our specialist societies like ESHRE, IUGA, European Society of Gynecological Endoscopy and Perinatal Health. And the whole idea is to improve women's health. And we also have a very good collaboration with UNFPA. And that's where I want to draw a close to my talk. And thank you for listening.